First name is Claudia, last name is Del Toro, and I'm a physician assistant, and I'm also the phlebotomy program director at UCLA Center for Pre-Hospital Care. I first attended undergrad at a community college at Antelope Valley College, and then I transferred to Cal Poly Pomona University, completed my undergrad there, and then I transferred for grad school and physician assistant school to Stanford University. I was raised in the hospital setting. My mother had pulmonary fibrosis, which is a condition that requires a patient to be in a hospital or, in a clinic setting. So I just naturally grew up in that setting. And I think that's what really inspired me to always want to be a part of the healthcare field. So at the age of 18, I started working as a medical assistant / phlebotomist. And I had the opportunity to work around doctors of osteopathic medicine, nurse practitioners, and PAs. And I had the privilege to see the difference between a doctor and a PA when it came to patient care and the amount of time that they were spending with their patients. And for me, it was about trying to make a difference and really being there for my patients. And then also quality of life when it came to personally. I felt that as a PA, I would have a better chance to be more at home with my family and at the same time provide high quality care. And I had all the hands-on experience. So at the age of 24, I went ahead and I switched from pre-med studies to becoming a physician assistant. We do not have to go to medical school. It is a master's program. Doctors go to school a lot longer compared to PAs. You're not required to take the MCATs. You are required for some schools to take the GRE though. But no, you do not have to go to med school. Anything with direct patient contact, that's what's crucial. We require a lot of hands-on experience. So anywhere from a medical assistant to a phlebotomist to an EMT to a paramedic. And believe it or not, sometimes also we even have foreign doctors who've come over to this country and they want to become PAs. So that also counts as patient experience. And then sometimes we even have nurses who they want to make the transitions from nurses and maybe they don't want to go down the route of a nurse practitioner. They want to go down the route of a PA. You could do that also. So once again, just to recap, medical assistant, phlebotomist, EMTs, paramedics. That's really what's crucial, and just having direct patient care. The medical field, they're very, very heavy with the science courses. So you have to make sure that you feel comfortable with science courses. The first one that I would most definitely recommend is the anatomy and physiology courses, because that's heavy in any healthcare field that you go to, either be nursing or PA or EMT, paramedic, that's always going to be in there. And if you have a basic foundation on that, then you should be able to succeed in whatever you decide to do within the healthcare field. And then I would always explore also those short-term programs such as EMTs, such as medical assistants, phlebotomy, because I think those are nice introduction programs to the healthcare field and really kind of test out, right? Is this really where I want to be? And at the end of the day is you have to do what makes you happy. And hopefully you'll be able to go out there and make a difference and really at the end of the day, go home and feel fulfilled with what you're doing, because you're going to spend lots of time and years training for this and school for this. So once again, at the end of the day, once you go home, you have to feel good about what you did, you made a difference, and you have to feel fulfilled. Free clinics are always in need of volunteers. For example, for us, we collaborate with the Hollywood Sunset Free Clinic, also the Venice Family Clinic. They're always looking for volunteers. And I know that UCLA here, they also have a volunteer program for students who are looking to become PAs. But yes, most definitely, that's where I would start off with, looking and getting in touch with the free clinics.